Good morning. Good morning to the beautiful state of
Morning.
Washington, people.
Yes, good morning.
Good morning.
So we'll be starting here in a few minutes. And just so everybody's aware, we are recording. For the chat.
Good morning.
Good morning.
Jasmine? Yes. Are you on the phone or are you ignoring your phone call? Oh.
We'll be getting started in about 1 minute. Good morning, everyone, and welcome to our training, Permanent Supportive Housing as an Evidence-Based Practice, the Basics, presented by Advocates for Human Potential. I am Anita Jackson, and I want to just tell you a little bit about myself, and I'll turn it over to my colleague, Nikki, to share a little bit about herself. I have worked in implementing evidence-based practices in behavioral health, human services, housing and homelessness, affordable housing, trauma-informed care, community outreach, senior services, and youth in transition for over 20 years. I have experience in nonprofit management, government and monitoring, oversight of federal, state, county, and local levels, community development, training and TA, project, contract, and grant management, coordination, planning, auditing, and direct services for people living with disabilities. My expertise also includes providing program evaluation and training and technical assistance on sustainability in all aspects of permanent supportive housing for SAMHSA and HUD. So I'm happy to be here today, and I'll turn it right over to my colleague, Nikki, to introduce herself.
Hi, everyone. Good morning. I'm in the beautiful state of Arizona, and I just want to let everybody know that we are recording this session, those of you who are just joining us. So again, I'm Nikki Stevens. I am with Advocates for Human Potential, and I have a master's degree and a bachelor's degree from Arizona State University, and I'm a certified public manager as well. I have almost 20 years of experience of providing housing and supportive services to people experiencing homelessness and with behavioral health needs. I have worked as a chief programs officer. I've worked with families experiencing homelessness, our veterans, youth. I've worked in probably every intervention there is that comes out of the HUD continuum of care. So I'm here to support my colleague Anita and to go over some of the permanent supportive housing basics with you all to hopefully help you get ready to apply for the certification training that maybe come up in the future. We were in the state of Washington a few months ago, my other colleague, Pat Tucker, and we were able to provide the first inaugural certification of permanent supportive housing fidelity. So I will go ahead and get us, or I'll have Anita go ahead and get us started. Welcome, everyone.
Great, thank you so much, Nikki. Next slide, please. So now it's your turn to introduce yourself. Please tell us a little bit about who you are and use the chat, please. We'd like to know your name, your pronouns, your organization, maybe your position or your title. Also, what housing experience do you have? And you can be pretty brief in that. You could say you have 2 years, 10 years, in reference to housing experience. And one icebreaker question: if you could travel anywhere in the world, where would it be? So we're gonna look in the chat for your responses. Okay, hi Cruz. Okay. Housing Division Director, welcome. Molly. Oh, wow, really? We might have you talk a little bit about that as we go on into the training. Hello, Amanda. 8 years of experience. Wonderful. Oh, somewhere tropical. Nice.
New Zealand twice, I see.
Oh, really? Faith, 11 years in housing. You'd like to go to Ghana? Oh, okay. Wonderful. We have another Nikki. We have a Nicole here from far as wanting to look at New Zealand as a place to go. Scotland. Wow, we have a lot of different places. You guys, I think I want to travel everywhere you guys are naming too. So Africa, look at that. Oh, I love it. Love it. Yes, Jessica. Oh, 10 months. Okay, Jessica, that's good. We're happy to have you here. Yeah. Oh, yeah. Oh, Amanda, you forgot. Oh, no problem. You're good.
Yeah, I want to see the Northern Lights also.
Oh, nice. Michelle, Denmark, huh? Yeah, you guys have chosen so many good places. What I was thinking, I'm going to throw that right out of the window because it was just too local compared to what you all chose. Mexico, oh, Dubai. Oh, yeah, I hear it's beautiful there. That's a great choice.
Japan, I heard Japan's amazing.
Mhm. Yes, look, Sweden again. Wow, yeah.
Finland, nice.
Iceland. Wow, you guys have chosen some great locations. And I'll tell you in a second, Greece. Oh, I like that. Japan. Nice. Wow, you guys have a wide range of experience. I love this. This is going to be a fabulous training. We are happy to have each and every one of you here. This is just wonderful.
Samoa, yeah.
Oh, wow. I mean, it's just Spain. Wow.
Greece, I want to go to Greece too.
Oh,
you guys
right.
are teasing, getting me all excited to travel.
Finland, Australia. You guys have some great choices. So let me tell you why we asked you all that question. Because we're talking about permanent supportive housing, one of the things that we'll mention during this training is choice. So you have a choice to go there, live there, whatever that case may be. And that's why we brought that up, just to kind of let you think about choice, because I'm sure each of you, if you have the means, you have that choice to be able to go to any of those locations that you guys chose. So we thank you all so very much for participating in that particular icebreaker. Next slide, please. Our learning objectives for today for permanent supportive housing basics are we're going to discuss the evidence-based practice a little bit. We're going to go over a little bit about the permanent supportive housing key elements, why assess fidelity, person-centered assessments, active listening, engagement tools, 7 dimensions of permanent supportive housing, along with some other things. But these are our basic learning objectives for today. Next slide, please. So in this particular slide, rate yourself in the chat. What is your knowledge of permanent supportive housing? 1 being the lowest, 5 being the highest. So can each of you rate yourself? Okay, Derek, 3, Rhonda, oh, wow.
8, I love that.
Wow, love it, you guys. So I see, I'm looking at it, and on an average so far, I see kind of 2 and 3, which is wonderful. You guys will get a lot out of this particular training. So yeah, well, the person that said 8, okay, they're gonna probably, we're gonna call on. Just kidding, just kidding. We really are excited to be here though, and we thank you guys for participating in that particular slide in reference to your knowledge base on permanent supportive housing. Guest speaker, that's right, Derek. Next slide, please. What is evidence-based practice? Evidence-based practices is the process used to review, analyze, and translate the latest scientific evidence. The approach of evidence-based practice includes ongoing important review of research to determine what is credible and what policies and practices are the most effective with current research. There are guidelines with critical components, and evidence-based practices assist participants achieve their desired goals and outcomes when implementing fidelity. I tend to think of this tool as it brings credibility and reliability to your work with the participants. Some examples of proven methods are supported employment, supported housing, supported education, and the ACT teams. Next slide, please. So on this side, we've just provided you all with some resources for permanent supportive housing. To our left, we have the evidence-based practices from Washington State Institute for Public Policy on evidence-based practices. And then on the right, we have the SAMHSA evidence-based practices PSH toolkit. So those links will drop in the chat for you all so that you'll have those. And there's some very good and vital information in there for you guys. So it's good to be able to read it when you get a chance. Next slide, please. The premises of permanent supportive housing. Let's take a look at this. Let's start with staff's role. The staff role is to support the person in their journey. So that's going to be extremely important because they're going to establish a rapport with you and rely on you as the expert to kind of help them through what they need to go through. The participant, they do need unbiased information from you as a staff person to make their own decisions. So that's going to be extremely important. Good effective partnerships work together to treat the whole client. So that would be from the entire treatment team to work together so that you can support the whole client. The client can make their own decisions. That's going to be vital. That's choice, just as we were talking about earlier. And the participants need individual plans because people have different needs, and they actually do. So that is one of the main reasons why it's so important to have that individualized plan for your participants. Next slide, please. So let's talk about some key elements of permanent supportive housing. Leases or rental agreements do not have any provisions that would not be found in leases held by someone who does not have a disability. Participation in services is voluntary, and tenants cannot be evicted for rejecting services.
It has been changed and will now be used.
Lease requirements are the same to be found in housing for people who do not have disabilities and who do not restrict visitors or otherwise interfere with their life in the community. Next slide, please. Housing is not time limited, and the lease is renewal at tenants and the owner's option. So if the tenant wants to renew their lease, if the owner is okay with that, then that's something that should be able to be done. Tenants have choices in the support services that they receive. They are asked about their choices and can choose from a wide range of services. Different tenants receive different types of services based on their needs and their preferences. As needs change over time, the tenants can receive more intensive or less intensive support services without losing their homes. Next slide, please. Let's do a word cloud. In the word cloud, I'm just going to ask you a question, and then I'd like for you to give me a one-word answer. So what is one word that assists participants in permanent supportive housing? So one word you can think of. Please put it in the chat. Money. I like that, Faith. Understanding. Good, Anthony. Christina, choice, stability, need. Oh, Love all your answers. Very good. Communication. Fabulous, you guys. Stability. Yes. Love your answers. Yes. Stability again. Goals, vision, sustainability. Perfect. Perfect. Yes. Support for sure. Yes. Safety for sure. Yep. Have to have a plan. Accessibility. These are all excellent choices when you're thinking of what is permanent supportive housing. Next slide,
Anita,
please.
Anita, someone said they missed the question. Could you go say it again?
Oh, I'm sorry. The question is, what is one word that assists participants in permanent supportive housing? Acceptance. I like that, Amanda. I like that. Yes, stability. Thank you all so much for your participation in our word cloud guidance, empowerment. Oh, love these answers. They are all fabulous. Very good.
And someone asked if the information would be sent via email. I think they're recording this, just so you're aware. And they should be sending this information out or the PowerPoint. Oh, sorry, Rayanne. There you go, girl. You're already on.
Thank you, Rayanne. Next slide, please. Person-centered assessment. What is person-centered assessment? It is an assessment that identifies services based on a participant's interest and their unique situation. It conveys goals and begins with valuing the experience of being present with another person. So trying to understand that person's experience and coming to know the uniqueness of that person is really important in person-centered assessment. The focus is on the participant's strengths. Emphasis is given to the settings, the services, the supports, and routines available in the community. And it involves the person-centered planning process and taking action so the participant can achieve his or her goals. Next slide, please. What is informed choice? Informed choice means that the participants that you are providing supports to can make their own decisions and understand all available options to them. So all available options, they need to be able to understand those and make their own and best decisions based off of those options. It means the information that you provide to them is accurate and what is needed from them in order to reach the goals that they are seeking. Informed choice includes explaining the benefits and risks of their decisions pertaining to their situation and providing all options. The process of informed choice is continuous and doesn't have an ending. Does not just occur one time and occurs through engaging, person-centered conversations, and different activities with the participant. Next slide, please. All right. You want to wait a little bit? You want to go ahead and take our break now, Nikki?
I think that we should, I think we should keep going because it's really 17 minutes in. So it's up to you, Anita.
Yeah, I think we should keep going. We'll take a break further down the line. Okay, sounds good. I'm listening, Anthony. We're going to keep going. Good. So I need you guys to participate in this part. Name all the choices. Do you guys know some of the types of housing? Some of the choices of living arrangements and different neighborhoods and supports that would assist your client in permanent supportive housing? If you do, you can put that in the chat. If you can think of any types of the housing that you think your client should go in, subsidized, shared housing, that's good, Nancy. Yep, Hen, that's good. Scattered site, tiny homes. Yeah, you know, we had a project here. I'm in Michigan, you guys, and we had a project here in Michigan where we did go ahead and utilize some tiny homes for clients for permanent supportive housing participants, excuse me. And it was fantastic. It was really a big news story that was centered around it. So reentry, tenant-based vouchers, you guys are just smart. Good grief. I'm loving these answers. Housing plus, facility-based, HCV, yes, the housing choice vouchers, the project-based vouchers, yes. Yes, reentry, low income, yes. You guys, yep, SEGRA, yeah, FCS, yes. Foundational community supports. So you guys have some excellent answers here. Thank you all so much. Next slide, please. Integration. Natural supports, they are vital. They're vital. So know that if a participant says to you, I'd like to have my family member, my brother, my cousin, my neighbor to be a part of their treatment planning, they should be able to be there. Those natural supports are vital and they're encouraged as well. Housing is in regular residential areas and neighborhoods. So it's called integration, and you'll hear Nikki and I talk a lot about integration during this entire training here because integration is very important. Mixing populations in buildings and neighborhoods that avoid stigma. So that definitely assists that participant in being successful in housing. The tenants participate in community activities and they receive community supports. Very good in order for their success. And 25% or more of the units are set aside for people with a disability, special needs groups, including homelessness. A lot of buildings, they do utilize 25 or more units so that we can make sure that it's integrated. So that integration is extremely important. Next slide, please. The rights of tenancy. I'm sure if you guys have sat down at all with your participants, you're understanding a lot about the lease. The residents, they have full legal rights in the tenant and the landlord relationship. So it's just like if I'm gonna go and rent a house, it's just like if you're gonna go and rent a house, there should be no difference between that. The agreement between the tenant and the landlord determines the length of stay. That's who determines how long they're gonna stay. The tenants must abide by normal standards of behavior and conduct outlined in the lease. So they follow the lease just as you and I will follow the lease. The tenancy is not contingent on program or treatment participation. So if they do decide that they don't want to participate in treatment, that doesn't mean that they cannot have housing. So that's separation of housing and services. And you're here, Nikki and I talk a little bit about that throughout the training as well. Next slide, please. Choose the correct answers. Okay, could be one, it could be more. Which of the following best describes how you or your organization determines if a person is ready for housing? First one, we use a written assessment. The second one, we consult with the person's team. The third one, we see if the person does well in day treatment or clubhouse first. The fourth one, we ask the person if he or she is ready. And the fifth one, we don't address housing with people who use our services. So can you please put in the chat if it's number 1, 2, 3, 4, 5, or all of them or some of them? 1, 2, and 3, okay. 4, 1, 2, and 4, 1, 2, and 4, 2, okay. We asked the participant if they're ready for housing, 1, 2, and 4. Number 3, 1, 2, and 4. Okay, who said number 3? Nikki, can you read that for me in the chat?
Number 3 coming from a clubhouse. That was Sarah.
So Sarah, we're going to talk a little bit about that. And I think we'll cover a little bit about, we see if the person does well in day treatment or clubhouse first, because this permanent supportive housing is housing first. So they do not have to actually necessarily do well in order to be able to move into permanent supportive housing. So with that being said, the answer is number 1, we use a written assessment. Number 2, we consult with the person's team. And number 3, we ask the person if he or she is ready. So all 3 of those in conjunction is what we should be doing when we are sitting down with our participants and we're talking about housing, because housing readiness is not a criteria for permanent supportive housing. Good job, you guys. I like your answers because it definitely brought up us. Now the SPDAT. Jessica, you're asking Darren, what is the SPDAT? If Nikki has some time,
Yeah,
maybe she'll talk about it a little bit. Okay.
Well, I mean, I could just tell you it's the service prioritization decision assessment tool. And it's a assessment tool you utilize to determine what housing intervention someone may qualify for. Just a short answer.
Good. I like that. Darren says correct. Thank you, Darren.
Thank you, Darren.
We appreciate you. Next slide, please. Active listening. Active listening means that you are seeking to understand the participant, that you're making sure that you are getting the correct message from the participant without passing judgment. Your initial attitude and your approach to engagement can set the tone for your working relationship with the participant and even his or her ultimate success within the program. The judgment part can be difficult sometimes, because we sometimes pass judgment and we don't even realize that we do it in many areas. Let me give you a couple of examples. You're kidding me. You're drinking again? Sounds like you're not really ready for an apartment. Now, we may think that those are not really anything that's bad to say, but at the end of the day, we are passing judgment if we say things like that. So we need to always make sure that we're opening the door to good conversation and that we're drawing out the participant with questions and reflecting on what we hear and see. Next slide, please. Housing affordability. Tenants or residents, as we call them in different states, they pay a reasonable amount of their income toward their rent and utilities. That's very important to have housing be reasonable. So HUD's affordability guidelines are 30% of the adjusted gross income for housing expenses. And in reality, people on SSI often pay 60 to 80% of their income toward housing that is substandard, because a lot of times they cannot find any project-based vouchers or emergency housing vouchers or low-income housing. And so a lot of times they're paying a lot more than what they should for rent. So housing affordability is going to be something to pay a lot of attention to when you are moving your participants to the next level of moving into permanent supportive housing. Next slide, please. You also need to find out what's important. What are the non-negotiables? Talk to the participant and say, what is it that you just totally know you do not want to have? For instance, it may be someone that says, I don't like to live next door to someone with a dog because the dog barks all the time and it keeps me awake. That could be a non-negotiable. It could be someone that says, I do not want to move into a building with children. That could be a non-negotiable because they may be single and they would just prefer not to. There's a lot of different non-negotiables that participants do have. So when you are discussing it with them, that's going to be important to be able to know what those non-negotiables are. If they have strong preferences about things, definitely note that so that you will have that in your progress notes to be able to understand when you start to assist them in looking for housing. And then what their negotiables are. A lot of times I think we may think that they don't have a lot of negotiables, but a lot of them are willing, to, like, for instance, because they're on SSI, they may have to pay the 60 to 80%. A lot of times they're willing to do that because they want to move. They want to move into their own unit. So that's very important as well. So talking to the participants are going to be extremely important. Being on a bus line is excellent. that Molly, because that's key. A lot of times people, because if they don't have a car, they want to be able to get around. Is there a park nearby? They want to be able to go to the park. Is there a library in the area? So lots of different negotiables that they'll be able to tell you, because you guys are establishing a rapport with that participant so that you'll be able to discuss what their negotiables are. Next slide, please. Some things to consider when you're talking to your participants in reference to housing are: what skills and history does a person have with choice making? They may not be sure, they may not be clear. So it's going to be important to give them the options and let them be able to make their own decisions and choices. How many options were identified and explored? You know, don't just take them to one location. Make sure they have a variety of locations in different areas. Some people may say, I only want to live on the east side. Some people may say, I only want to live on the west side. But if they just choose one side of town, please still make sure that they still have a lot of different choices, 2 to 4 sometimes. Different states require that you at least start with 2, and a lot of states may say go up to 5. Some people may require more, but it's based off of that individual preference of what their needs are. How was information provided? Your rapport with them, that's going to be important. Did you give them that option? I know one of the things that we did when we first started this years ago, we would make a booklet, and it would have a lot of different houses in a lot of different areas and kind of tell a lot about the amenities and everything. Or we would pull it up on the internet, pull up a lot of different locations based off of what their preference was. And then they chose some options. And then we take the participants to see those locations and then kind of move forward from there. So that's all really very vital and very important in helping them to understand what information is out there. Does the participant believe in availability and reliability of support? A lot of times, they just don't know. They don't understand that there are people here to support them. That's a part of what your role is. That's a part of the case manager's role, to support them in whatever their choices are. Does the person fear making the wrong choice? A lot of times they do. I know I fear in making a lot of different choices in just my own life in general. So I can't even imagine, of course. So definitely helping them, establishing that rapport and giving them those options and explaining that to them. Peer support. I want to bring that up because if you guys have any peer support staff within your organizations that know anything about permanent supportive housing or that may work within your departments, they're excellent when you are talking to a participant who may be nervous or they're afraid of their decisions. Talking to someone that's been through it before, or even one of your former clients former participants that moved into housing. Know that if you let them maybe possibly talk to them, they can sometimes understand that it's okay. It's not really a wrong choice. It's just what your preference is. Lack of housing. Oh yeah. Lack of housing. Yeah. I know we don't seem to have many choices in your areas. Yes, that's everywhere, Sandy, everywhere. That's unfortunate. And we have to do better in all of our states. We really do. We really have to do better. Does the person make choices to please someone else? So they could be pleasing, a significant other, they could be pleasing their mom or their dad, so that's something to also discuss with them. And your rapport that you're establishing with them will be able to assist them in making some of the right choices for themselves. Was there a discussion of flexibility? They may say, hey, I don't want to cook, or I don't like to cook, or I don't know how to cook. Or I don't want to live alone, or I do want to live alone. That goes back to those negotiables and those non-negotiables, those preferences. That's what that's about. Does the participant believe in their own right and ability to make decisions? Sometimes they've never had to make decisions in their own lives. So that's going to be important to let them know that's not a wrong or right answer. It's just what your preference is. Next slide, please. In order for the system to ever change, the participant is going to have to be given the dignity, and the right to fail. Failure is only the other side of success. As long as the system is bound and determined to prevent failure, they're going to prevent success. Tom Posey. That is so true in everything that we do. So it's important for us to explain that to the participant, just so that they'll know it's okay. If you make a decision that turns out not to be the best one for you, you always can come back and let's try it again. Next slide, please. Some engagement tools in having conversations with them for, when you start your conversation, giving a listening ear, that active listening that I talked about previously, that's very important. Being able to hear what they're saying and not always doing the talking, that's going to be extremely vital. Open questions, definitely. That's so important. Reflection. Let them be able to reflect on it. See things from the participant's point of view. Recognize what their strengths are and respect their fears, but also provide them with information so that it can help them to make an informed choice for what they're looking for in permanent supportive housing. Next slide, please. Separation of housing and services. Participation in specific support services is not required in order to get or to keep your housing. So that's something to tell them. The participant needs to understand that. The various approaches are the legal separation between housing management and service delivery. That is vital. Functional separation, distinct housing and service staff roles. Know the roles of the service staff and housing. Operational separation, service providers are based off-site. So within that apartment complex, the services provider should not actually have an office or location in that particular site. That is operational separation. Next slide, please. Facilitating choice. Identify options with the participant. What type of public housing that they may be interested in. Any privately owned scattered site apartments that they may have seen when they caught the bus to go to the grocery store. They may want to move into a trailer or manufactured homes. I know that we use a lot of them here in Michigan. Habitat for Humanity, contact them. They do a lot of home building. They give back a lot to the community. Programs for the elderly, excellent choices for seniors or people that are at the age where they can utilize those programs for the elderly. And shared housing. You guys may have a couple of clients that's looking for a roommate. That may be a good time to do what we call a meet and greet, where you have them sit down and talk to each other and see if they're interested in shared housing. All great options, but assist the participant in identifying them. That's a great way to facilitate choice. Next slide, please. So this is Mona's story. So we'd like your participation in this. I'm going to read it for you guys, and I'd like for you guys to give some responses in the chat when we get there. Mona is a 29-year-old woman. 3 years ago, after a 6-year hospitalization, she was discharged from the hospital into a group home. Her behavior in the hospital was often hostile and occasionally suicidal. She refused to participate in group meetings or day activities. She called them child's play. While living at the home, Mona learned basic daily living skills such as cooking simple meals and using a washing machine. She was rehospitalized briefly several times, twice for suicidal threats combined with aggression toward other residents, and once for an overdose of NyQuil, aspirin, and alcohol. She attends day programs irregularly and complains to the psychiatrist about the mental health system drugging her. She often threatens to stop taking her medication. Next slide, please. So you have a referral from Mona's case manager. is she a good candidate for your program? Why or why not? Can you please put that in the chat? So think about it. Mona had a few barriers at the group home, but she also did pretty good. So let's kind of discuss it a little bit. Jessica, you said, yes, she is a good candidate for your program. Housing first. Yes, she may need to live on her own if she'd like that. Very good, very good. Yep, Faith, I like that. Mhm. These are all great answers, and they're all correct as well. Yes, as their behavior is treatable. Yes, that is correct. What are the issues? What are the issues of concern for Mona? For the group home, or for you as the housing specialist? Suicidal tendencies, okay. It's good, Molly. Anyone else? Violence, okay. Let me go back, you guys, and see, because I know I just saw another one. Threats to other residents, okay. Give me 1 second, you all. Yes, so I noticed suicidal tendencies more than once. Living with others, conflict resolution. If there are underlying issues like schizophrenia, drug and alcohol use. Yep, okay. All valid concerns. Do you guys understand how you would address that in moving forward with her going to permanent supportive housing? Factors may create legal issues. Daily living skills, she needs daily living skills. Okay. All that are workable though. Yep, develop a sustainability plan. Excellent. That's excellent, Jessica. That's going to be important. Remember, the treatment plan is going to be vital because the case manager, as well as you as the housing specialist, are going to be working through all of these along with the participant. So you guys will be doing it together, collectively, working as a team to discuss what's going to happen. So definitely have a backup plan. What's going to happen if? And so all of the things that you guys named are important. If you guys discuss it with Mona and she realizes, oh, I think I do need to go into maybe just go to a day treatment or AA or NA, things like that. So there are always workable things that can still allow Mona to be able to move into permanent supportive housing. Daily check-ins, excellent, Anthony. Daily check-ins are great when you have a participant that may have a lot of things that's going on all at one time. Help them work through it by discussing that with them, their case manager, their psychiatrist, so definitely the participant. Let's talk about it, and so those are going to be key and vital. But you guys picked all really good answers. Thank you so much. Barriers need to be addressed with all for readiness. Of course, you definitely are going to discuss those barriers, Michelle. Yep, you're going to discuss them, but you may have to work with those in conjunction with permanent supportive housing. You shouldn't say, hey, you can't move because you have a drinking problem or, because you have suicidal tendencies. So those are some things to take a look at. Next slide, please. Name at least 3 of Mona's strengths. Did you guys pick up any of her strengths? And how might you use them to address her areas of concern? Nikki, can you go back to that first slide so they can kind of see? Derek, you said we have 24-hour front staff and they are a lifesaver. Okay. Self-advocacy. Look at Mona. She had basic living skills as cooking simple meals. That's a strength for her. Using the washing machine, that's a strength for her. Those are all strengths for her. Even though she doesn't take her medication, that would not prevent her from not being able to move into housing though. But again, there has to be a plan so that everybody will know what would occur. Yeah, and if she chooses to attend day programs, because she can't be forced to do it. But if she chooses, so those are things you as the housing specialist, as well as the case manager, and probably the whole treatment team, the psychiatrist, and everyone involved, including Mona, can sit down and discuss that to see if that's something that she's willing to do to help her to be successful in housing. Because it's going to be important to share with her, you know, your success in housing. You know, you have to understand some of the things that you went through. Let's try to see what we can do to help to prevent some of those things from occurring. So that's going to be very important in your discussion with Mona as well as the treatment team, but she also still can move into housing. Housing first is what has to be utilized with permanent supportive housing. Next slide, please. That's right, Sarah, very good. She might not be doing as much as some would expect, but she is putting forth an effort. Excellent, very good. And that's really what it's about, putting forth that effort. She's interested, she wants to move into permanent supportive housing. So we're here to support her in doing that. Next slide, please. Integration. Housing is in regular residential areas, so you guys are probably hearing this, so we're repetitious because we want you guys to remember this, that housing is scattered site. You know, you got to remember that anytime you are mixing populations in a building, in a neighborhood, that's going to be very good. Tenants participate in community activities and receive community services. Natural supports are encouraged. That integration is very important and vital to the success of the participant for permanent supportive housing. Next slide, please. Lived experience of permanent supportive housing. So on this slide, there was a focus group done for a lot of the participants that actually moved into housing. And this is what they reported. Satisfaction with choice in housing, increased satisfaction and pride in their living situation, more positive outlook on their life. That's beautiful. Appreciation for support services, sense of freedom, self-determination and empowerment, strong linkages with friends and family, and the appreciation for privacy and dignity and the control of the television. So I think that is beautiful. I love what they said in this particular focus group. Can any of you think of any other ones that you think would be great for any of the participants that you have worked with, that they stated their lived experience in permanent supportive housing? Safety, yes. They move into a unit so they feel they have more safety. That's great, Leah. Anyone else? More privacy, yes, for sure, more privacy. Excellent, excellent. Thank you. Encouragement with wraparound services, yes, yes, very good, very good. Anyone else? Stability, safety, and privacy, yes, excellent. And I'm sure you guys have heard this from a lot of your participants, you know, because these are things that they value in moving into permanent supportive housing. You know, it's amazing. And it's such a rewarding experience for you all as the service providers to be able to provide that service to the participants. Very rewarding. Gratitude for their successes. Yes, very good. Very good. Well, if there aren't any more comments in our chat, acceptance. I knew somebody was going to come. See, Faith, good. Acceptance, wonderful. Yes, you guys have. I love the fact that you're able to share some real life information from your participants, with the training here, because it's really, really just, I know, because Nikki and I both have worked in this field first before we became trainers. And it was so rewarding for me when I was able to move a participant into housing, confidence, hope, recovery. I mean, all excellent. Control over food schedule and what participants eat. Yes, excellent. Yeah, very good, Leah. I mean, it is so many things that we can think of. And it's just so rewarding to be in this field. I mean, you guys are, you save lives, because a lot of people moving into permanent supportive housing, they actually, it assisted in their longevity. And that was a study that was done as well. Freedom to shower and hygiene how they want to. Love it. Self-esteem. Yes, for sure. Yes, very good. Yeah, you guys have excellent answers. No one else? Okay. All right. All right. Thank you guys so much. I think we're going to take a 10-minute break here, and we will see you guys back shortly.
I'll
Thank
start the
you.
timer. I'm sorry, Anita. I'll start the timer right now. So at the top of the hour, we'll begin. And you're also welcome to put anything in the chat if you have questions during the break. Thank you.
Thank you all.
All right, so we're going to go ahead and come back from our break. Hopefully you guys were able to use the restroom or get some coffee or answer some emails, whatever you needed to do. Okay, so Darren, thank you for joining us, Darren. Okay, Alexandra. Okay, so we're going to go ahead and begin on my part 2. So what we're going to begin with is why assess fidelity. So how can fidelity organize program operations? So why is it important to, assess fidelity? So as Anita pointed out earlier, the permanent supportive housing model is an evidence-based practice, and it's used for a certain reason. There has been multiple studies have done on the importance of permanent supportive housing and how it increases people's ability to live longer and the autonomy it creates for people and structure in their lives. So efforts can be structured to maximize choice for people when they're going into permanent supportive housing. The team can use fidelity dimensions as a part of their daily practice. And I'm going to go into each of those dimensions a little bit later and talk to you about why it's important. And also many of the organizations that you may work for or work with get what's called a permanent supportive housing fidelity review done by the state of Washington. So it's important that what you're doing boots on the ground is matching the efforts from a fidelity model. So supervisors can also use fidelity dimensions as a part of their clinical supervision and the ability to look at each person on their team to see if they're actually using the PSH fidelity model. So, studies have shown, as I said, the permanent supportive housing's effectiveness, and it continues to grow. Anita showed a lot of the outcomes from focus groups of people that have been in permanent supportive housing and how it just increases their well-being. And we all know this. If you have a safe place to live, it makes you just feel better. If you're in a safe community, you have your friends, you have your family, you have all of your natural support. So that's extremely important to not forget when you are trying to house somebody in a permanent supportive housing program. So those long-term outcomes are more positive than previously known. We know that people in permanent supportive housing live longer. They see their primary care physician and their doctor. They're able to treat their illnesses, and they're able to get recovery treatment, substance use and alcohol use. They're able to get those needs met. And permanent supportive, I can't even talk. Permanent supportive housing produces a good return on investment and sustaining the 1115 FCS services. And steady housing promotes improvement in other life domains. We often say housing is healthcare, and this is why, because of all of those other great things that happen when somebody has a decent, safe place to live. And what gets measured gets done. So if you're not measuring it, if nobody's measuring this to see the effectiveness of it, you're not going to really do it. So that's why it's important when we talk about permanent supportive housing fidelity model, that everyone's following the same model and there's continuity of care that's provided for the people that you're serving. So no matter what permanent supportive housing program someone goes into, they're receiving the same supports during that time they're in tenure, they're in your program. So just to go over the 7 tenets of permanent supportive housing, the quality, I want to say quality permanent supportive housing. And these are the 7. These are what every organization that receives state funding has to abide by. So these are those tenets, and I'm going to go into more detail around those tenets, and that's choice of housing. Is it safe and affordable? Are they integrated into the community? Is there a separation of housing and services? Are the services voluntary and flexible? And access to housing, meaning housing first, as Anita had touched on earlier. And also the full rights of tenancy. Is the lease in their name? So I'll go into those details right now. So dimension 1 is the choice of housing. Do tenants have the choice of the type of housing they want to receive? Do they want to be in clean and sober housing? Do they want to be in an apartment? Do they want to be in a house? Do they want to live with their family, their friends, their cat, their dog? Whatever that is, they're able to have a choice. And the real choice in housing units. So, exactly, do they want an upstairs unit? Do they want a downstairs unit? Do they want to have a pool? Do they not want to have a pool? Do they, all of those things that we all look for when we're looking for a place to live. Are they shown multiple units to choose from? So have you, like Anita said, have you created some type of booklet or some type of way that you're able to show them multiple units in different places that they're able to choose from to live, so that that's a part of the choice in housing, and not directing somebody where they need to go? Is there a waiting list? If there is a waiting list, if they have to wait for another place to be available, do they lose their position on the waiting list? That shouldn't happen. So if they want to go into clean and sober housing while they're on the wait list, that should not preclude them from being able to stay on the wait list and be able to access permanent supportive housing down the road. Also, choice of living arrangements. Does the tenant decide who they can live with? So, somebody brought up shared housing. Is it an apartment? Is it a house? Am I with my brother, my sister, my mom, my dad? Who is it? My boyfriend, my husband, whoever that is, the tenant decides who they live with. It's not up to us. It's about their choice. And also dimension 2. So this is the separation of housing and services. So, a lot of people confuse this piece, and I know sometimes, there's just not enough staff to go around, but it's always important to have a clear delineation between housing and those supportive services. So housing management, they're the ones that collect the rent, ensure that the property is maintenanced, making sure the clogged toilets are, fixing, air conditioning, whatever that is, and security on the property as well. And there should be a clear separation. The supportive services, that's the case management, the peer support, the housing specialist, all of those folks who support an individual on their life goals while they're in a housing program. So is the housing provider also providing those services? So again, making sure that when you are being evaluated and are assessed, that there is a clear delineation and it's documented that it's separate. And does the service provider collect rents as a peer support? I shouldn't be collecting rent from someone in my program that I'm providing those supportive services to. That should be kept on the housing side. And do the service provider have an office located in the housing? So sometimes there's, what we call project-based housing, and there's on-site supports. So it could be either way, or, you're in scattered site housing and those supports come to you. Again, it's about the choice of the person that's in the program. And the next dimension is decent, safe, and affordable housing, dimension 3. So what % of their income must tenants pay for rent? Anita went over that earlier. They should not be paying more than 30% of their income towards rent. And that needs to be documented. So when the state does go out to a housing program, they should be there should be some documentation on file showing that what the tenant's income is, whether it's 0 or, they get SSI or whatever, or they work. It should show how much their income is, and then it should show that they're only paying 30% of their income towards the rent. Also, does the housing meet the U.S. Department of Housing and Urban Development, HUD's Housing Quality Standards, HQS? So this is really important that, every unit that someone moves into prior to moving in and prior to signing the lease, that unit's inspected to ensure there's either a habitability inspection or a HQS inspection, HQS being a higher standard, making sure that place is safe for them to move into, making sure there's no, live wires. Does the plumbing work? Are there any leaks? Do the fire alarms work? All of those good things, so that when somebody's moving into a place, that it is safe for them to move into. And also, you don't want to be paying rent for a place that is just not up to par.
Nikki?
Yes.
So Nancy has a question. If a client has a housing voucher and has paid through the end of the year, can he lose his housing if he needs to go into RTC?
What's RTC?
Nancy, can you come off of mute, please?
Yes, it's a residential treatment center.
Okay, so
Thank you.
Thank you, Nancy. So there should be guidelines within each program that outlines how long you can be out of the unit. So when I was running a housing program, I would let people out of the unit for up to 90 days, as long as they have a plan in place of how their portion of rent's going to be paid. So they can either set it up through a payee or through someone else, or family or friend, or if you're a housing provider and you're paying 100% of that rent, then it shouldn't matter, right? That rent's still being paid to the landlord. But we would allow, it just depends on the program, but we would allow it up to 90 days if somebody needed to go into residential treatment and they wouldn't lose their housing.
Okay, this client in particular, another agency has paid his rent through the end of the year.
Oh, that's great.
Yeah.
So yeah, as long as you inform the land, I don't think it's never been an issue where I'm from, as far as allowing that person to get the treatment they need. If their rent's still being paid and somebody, waters their plants or has their animal, if they have an animal and the unit's maintained, it shouldn't be an issue. Just like if we all went to treatment, it wouldn't be a difference, right? As long as our rent's being paid,
Right.
Everybody's treated equitably. And as long as that rent's being paid, that it shouldn't be an issue.
Okay, great. Thank you so much.
You're welcome.
Nikki, we have another question.
Yeah, please.
Give me 1 second. Let me locate it. I work in permanent and transitional housing. In the transitional housing, I collect rent and provide supportive services to my tenants. Can you suggest a way to do this in a balanced way?
Can you repeat it, Anita?
Yes. I work in permanent and transitional housing. In the transitional housing, I collect rent and provide supportive services to my tenants. Can you suggest a way to do this in a balanced way?
Okay, so transitional housing is a different animal. So transitional housing, a lot of that is a part of the program, you know, because I ran a transitional housing program as well, and we wouldn't physically collect the rent, but that tenant would go pay their rental portion to, you know, our organization. And so that piece is different than permanent supportive housing. So if it's becoming too much for you, if it's overwhelming, try to identify a person. If it's not you, if you just want to provide the supportive services, if you have a housing specialist or someone else that can do that piece, or you have property management that can do that piece, that would probably be the best bet. Any other questions, Anita?
No, that's it for right now.
Okay.
She said,
Hopefully
thank you.
it helps answer it, but yeah, transitional housing, yeah, it's a different animal up to 2 years. You know, they have the on-site, you know, the supports and all those types of things. And it's not as flexible as permanent supportive housing.
Rayanne also did give a response. Rayanne, I'd like to read it if that's okay.
Yes, please.
She said 100% what Nikki said. Also, your supportive housing trainer with HCA can help you navigate this if you are interested in longer term support around this issue. Please email me if you are interested. So definitely email Rayanne on that if you are interested. Thank you so much, Rayanne, for that response. We do have another question, Nikki, if that's okay.
Yeah, of course.
What if a client is looking for housing outside of the subsidized housing system? If their income is $900 to $1,000 per month, any suggestions on that?
So that it is about choice, right? So, I mean, it's having a discussion with them. If that's their income, how much is the rent? How much, you know, it's a budget discussion. So it's sitting down with them saying, this is how much money you have per month. This is how much the rent is. Cause I know depending on where you're at in Washington, the rents could fluctuate. So sitting down with them and having a real discussion with them. So here's your rental portion. You're only going to have $200. You know, I'm just making something up. You're $200 left a month. Is there utilities included in the rent? How are you going to buy groceries? Do you receive food stamps? You know, all of these things that you have to walk through. How are toiletries? How are you going to, buy things that you need for your house? How are you going to wash your dishes, wash your clothes? So it's a budget. That's really a budget discussion and breaking it down with them, because they have the right and choice to go out and not use subsidized housing, right? It is about choice, but then they have to understand it's our jobs to explain to them all of this piece so that they know all of the outcomes if they choose not to participate in the subsidized housing program. So it's just about choice and allowing them to make the choice. Again, Anita had that a slide up earlier. Sometimes we all have failure. We all have to mess up, and that's how we learn and we grow. But again, it's breaking it down for them, going with them through their budget and saying, okay, can you really afford to go outside of a PSH program or a subsidy program? And what are you going to have left over for income? And then you show them, if you go this route with PSH, you pay only 30%, you're going to have X amount of dollars left. That allows you to go to the movies, allows you to do other extracurricular activities that you may not otherwise be able to do because you're paying the full amount of rent. So just using those pros and cons and allowing them to make that decision, what's best for them. Hope that's helpful. Okay, so I will keep going. Talked about HQS, no more than 30% of your income towards rent and utilities. Again, document. If it's not documented, it didn't get done. So you could tell us, you know, if I'm going out to do a fidelity review at your organization, you say, well, they're not paying more than 30%. Make sure that's documented somewhere in the file. Also, those 13 key areas of an HQS inspection, you know, when the inspector goes out, that all of those areas that they're meeting them all, there's no vermin, there's no, you know, I hate to say roaches even, but no roaches, none of that stuff, that it's a decent, safe place for them to live. And also to have that HQS on file. If it's a habitability inspection or an HQS inspection, that should be on file, and that should be on file and dated prior to the lease signing. And it should be done on an annual basis to ensure that the person is living in a safe place.
Faith made a comment. When we need to document their income, do we need evidence, and how do we get that evidence? So that's a question. I
So,
apologize.
no. So I guess the question is, so how do you currently do that? Do you collect paycheck stubs? Do you get their social security, income, award letters? So it's putting that stuff on file. And, different programs have different ways. So there's an annual, usually if you're going into a HUD PSH program, there's, you fill out all the paperwork ahead of time. They give you your paycheck stubs or award letter and all that stuff. So that should be on file. And then you do a rent calculation. So there's a rent calculation that needs to be done prior to the person moving in, so that you document. There should be a rent calculation form that's on file that documents what the person's income is, and they can do a zero income questionnaire. There's a zero income form that's usually provided if they have zero income, and that's documented in the file. So just making sure that's documented somewhere, that you collected income and that they're only paying 30% of their income towards that rent, whatever that rental portion is. Hopefully that's helpful. Okay, dimension 4, housing integration. So Anita went a little bit over this. So when you're going to be assessed for permanent supportive housing fidelity, you need to have it documented that, that the people are integrated into a community that's not concentrated with all homeless people or all people with serious mental illness, so that there's some documentation on file. I showed them 10 units in these areas, and they chose to live here. So something either in the notes that you put in, either in HMIS or some other place on file, just documenting that they're able to, they had a choice of where they live, and they're integrated, and it's not concentrated area. There's also ways to look up zip codes to see if it's a high concentration of poverty in that area, and just suggesting that, again, it's about choice, but you can let them know, hey, maybe you want to choose somewhere that's closer to your clinic or closer to your family or whatever that may be. The tenants are placing units set aside for individuals with disabilities, or are they living in scattered site? The ideal is for individuals to live in the housing units typical of any community member without clustering people with disabilities. So again, it's about choice and integration into the community that they choose. Dimension 5 is rights of tenancy. So this means that the lease is under the the participant's name. So the lease is under their name. They don't have to follow any special extra rules to be able to live there. Just like you and I, we sign a lease and we go about our business, and it's, because it's our lease. So they don't, example of rules that are not on a standard lease, like no guests after 10 a.m. That probably should be 10 p.m. Drug testing to qualify. I hope it's after 10 p.m. Drug testing to qualify for the program, and must be enrolled in services to live there. That is not rights of tenancy, because any of us, we do not have to abide by these things in order to live where we choose. So, one of those red flags is to look at, is the housing tied to services? It should not be a prerequisite that the person needs to be enrolled in services in order to get the housing. This is housing first, and it's about choice. So this is about meeting the person where they're at. And maybe at that time, they may not want the choices. And I often used to tell my staff, the services are voluntary and flexible for the people we serve, but not for us. You continue to engage with people. And when they're ready, they'll come to you and say, hey, Nikki, you talked to me about that program last time. That's something I'm thinking about now, and I'd really like to try that out. Or, hey, I would like to get X, Y, and Z. So it's about continuous engagement, active engagement of individuals, meeting them where they're at. So dimension number 6 is access to housing. Is there a housing readiness criteria? That's a big no-no. I don't know who put that in the chat, but the word readiness should not be a part of housing, period. Because who are we to say when somebody's ready for something? It is about their choice. So there should not be any housing readiness criteria or artificial barriers that people have to jump through in order to access housing. Housing first literally means that you provide somebody with housing, and you wrap those services around them and meet them where they're at. And the hope is that they will eventually say, you know what, I'm ready for X, Y, and Z. But that is, access to housing, readiness, are people, or there barriers to housing prioritized, that should be prioritization. Who holds the keys to the unit? The tenant should be the only one that has the access to that unit. So it shouldn't be that the housing specialist or the case manager, the peer support has those keys. It's just like you and I, nobody else has a key to my unit. And that also creates that safety for people who are oftentimes traumatized from living in spaces where they could not lock a door. So making sure that people have access to their own housing and who can enter their unit without the tenant there. If a maintenance guy needs to go in there, he needs to give you a notice, or the landlord needs to go, they need to give you notice. It's just like any of us. You can't just walk into somebody's house. That is not access to housing. And documentation should be on file that the participant had choice and did not need to meet requirements for program. I talked about this, voluntary and flexible services. This is so important that we're meeting people where they're at. There should be a menu of options for the type of services to choose from. If you have all these services in your organization and the people that you serve do not know about them, it's not a good service to the people in your program. So outlining all those services that you all provide and go through that menu of services, because a lot of people don't know what you all offer at your organization. So maybe creating the menu of the services you're providing, get a magnet with your number on it and put it on the refrigerator when the person moves in, so that they have say, you know what, maybe I do need helping with independent living skills, or I need help with cooking, or I need help with grocery shopping, budgeting, whatever that services that you all provide. And can a person change the frequency and intensity of their services? Yes, yes, yes. They should say, no, I don't want any services, or yes, I want everything on that menu. Give me everything. So we need to be able to offer them that option and the choice. Again, can the person choose no services? Yes, they can. I know a lot of people think, it's permanent supportive housing, but those supports are voluntary and flexible. So it's not about us telling people what they want. It's about them choosing what they would like. I don't like the word consumer. We should change that. Are the services tenant driven? So those services, when you do an ISP, an individual service plan, you write that stuff down. What do they want? And that's part of the assessment, and writing down exactly what they want to progress in their lives. And what's typical caseload look like for service providers? The optimal, and I know this isn't for everybody because we all are understaffed and overworked, it's usually 15 to 1. So there shouldn't be more than 15 people per one tenant on your caseload. And that's something that will, when you do a fidelity review, they'll look at that and see what the caseload is like for each of the housing specialists or peers or whoever's on your team. And are the services provided by a team? Are the services available 24/7? If something goes bump in the night, who do they call? So making sure that that is an option for somebody if they're in need of something. Okay, so I'm going to go. So I went over the 7 dimensions of permanent supportive housing, and what a fidelity reviewer that goes to an organization will look for in the file. Making sure you're documenting everything is extremely important. Anything that you do should be documented with that individual. And right now I'm going to just go over some strategies for success for people in the permanent supportive housing program. Anita, are there any other questions?
No.
Okay. So one of the things that these are just some of the things that I've been a housing specialist, so I understand how difficult that job is. So one of the number one priority when somebody gets into permanent supportive housing is prevention. So being proactive with the people that you're serving, work with them on a regular basis. When you go and visit them, also visit the landlord. That's something, I'll talk about a little bit, but working with the participants regularly. How is their mental health? How's your physical health? How are you getting along with your neighbors? Are you currently having any issues in your apartment? Are you having any problems? Have you found everything that you need in the community? Because a lot of people move into places and they don't know where anything's at. So maybe having a day where you get on the bus line or drive them around to places and identify what those things are in the community that they may need. Whether that be NA, AA, their clinical team, where's the church, school, all of those things. So just being proactive with the landlord. So let me tell you something, on scattered site, the landlords are your customers and they should be treated as such. As we know, there's hardly any landlords we have available in the community right now. So treating those landlords special is important to, number one, get additional units into the community. Making sure that you're being responsive to your landlords lets them know that this program, wow, this program is responsive every time I call. They're checking in with me, making sure that the rent's paid in time. I would set up a monthly schedule to check when you're, I don't know how often you guys visit your participants, but check in with that landlord when you check in with your participants. Ask them, hey, is there any issues? How's everything going with John today? Just checking in with him or her and making sure that they know you're available. And what to know, some of the things that are important as a service provider when somebody gets into permanent supportive housing is understanding the legal responsibility of the landlords and tenants. So do you understand your landlord tenant laws in your area? Understanding those is important because you can protect the people that you're serving if a landlord is taking advantage of them. So what are those fair housing laws? A lot of times people are discriminated against and they don't even know it. They could be discriminated against because of their disability, for their skin color, for multiple things. So understanding your fair housing laws is extremely important to ensure that the people that you're serving are treated equitably. Your organization's policies on landlord relationship management. Is there a policy at your organization on how you interact with the landlords? Because this is extremely important, because if something comes up, you want to be able to point to a policy. And if you have paperwork that's signed with that between the landlord and yourself, that you have documentation on file and the landlord understands that and the tenant understands that. And also, do you guys know how to do a mutual rescission of a lease? Can you can answer in the chat, yes or no. I'm just curious.
There's a question.
Yes.
What can we as support staff do to help our agency did we answer that? Become more housing first and improve our fidelity. In my case, FCS fidelity.
Okay, and they're often going to be pushed back if needed changes.
Yes.
I think,
Mhm.
Riley, I think that's a great question, and Rayanne could probably jump into this as well, but I think you model that behavior, and if you understand it, sometimes you understand it better than your bosses understand it, and that's just the way it goes. So, modeling that behavior, pointing to evidence-based practices, using the weight of the state and saying, these are the things they're looking for. They want to make sure we're doing X, Y, and Z. And, sometimes when funding's tied to things, that's when people will listen. So, and Rayanne, I don't know if she may have a better answer for you than that, but I think modeling that behavior, making sure that you're adhering to those principles of housing first and to the SAMHSA fidelity model of permanent supportive housing. And you could use that, and supervisors can use that also to make sure that their staff is doing what they're saying they're going to do.
Rayanne also put something in the chat that there are sample documents, including a formal check-in guide and additional self-paced training modules on Pathways to Housing website. And she's provided a link. So this would be great for everybody to take a look at.
Thank you, Rayanne.
Yes, we appreciate that. We do have another question. Or it could be a comment. Your supportive housing trainer can also help with training on landlord tenant laws and fair housing. Additionally, our next the next training will be Marley from Northwest Fair Housing to share updates and important information. Is that from Rayanne? That's from
Yep,
Rayanne.
that's from Rayanne. Thank you, Rayanne.
Thank you, Rayanne. Mhm.
Yeah, that's great. And so a mutual rescission of a lease is basically if say something happens with your tenant in the program or in the housing, and you can go to the landlord and say, hey, can we do a mutual rescission of the lease? This keeps the tenant from having an eviction on their record. So if they say, I'm going to evict them, they give them a notice, 5-day notice, 10-day notice, and say, we're going to evict them. You can go to them and say, can we do it instead of eviction, which is a more expensive route? And also from the tenant side, it creates more barriers for them to access housing in the future. Can we just do a mutual rescission of the lease and they'll be out in 10, 15 days or whatever it is, so that that allows that person not to have that on their record, either a judgment or an eviction on their record. And it just allows a clean break from the landlord, and the tenant can go their separate ways. And we can, mutual terms are great too. Yep. All right, I'm gonna go to the next slide. So what to do? Number one is review the lease with your participant before they sign it. Make sure they understand that they can't have their friends over there smoking weed at their house and, all those types of things, because your tenant, anybody that comes visits that tenant, their behavior is their responsibility. So if they get in a fight with another neighbor, if they do something egregious, and that could be an automatic eviction from the program. So making sure that the participant understands the lease, understands what portion of rent they're supposed to pay, and understand who they need to contact to pay that rent. So that's extremely important. Create an emergency contact list. So if something does happen, they know who to call. Have you guys set up protocols on who someone can call if something were to happen, not out of your regular business hours? And if I'm on vacation, is Anita available for someone to call if I'm not there? So making sure you set up those emergency contact lists and you put it on the refrigerator, stick it there when they move in, and they know where the food pantry is. They know where if they need assistance with their rent. They know where the, utility assistance. They know where the church is, the hospital, the clinic, all of these things, just putting something that they know who to contact. I also, talked about, also having those regular, like I said, check-ins with your participants and landlords. So if you haven't set up regular visits, home visits, do so. It's just a, hey, how you doing? And sometimes you'll go into some of these units, you're like, wow, they don't have any food. That's something that you're like, okay, it's something that you may observe. You go there and you say, oh, is there beer cans everywhere? Maybe there's some way to offer services. So and also, bring them a food box. It's an engagement tool. How can you engage with folks and meeting them where they're at? So also, as I just said, preventing evictions whenever possible. That's number one. You don't want an eviction on the people that your serves record, because they may already have barriers. So you're just creating another barrier. So preventing those evictions. That's why checking in with that landlord and checking in with your tenant as much as possible is extremely important to make sure that there's nothing that's happening that you're not aware of. Again, review the lease with the participant before they sign. And I think I talked about this, create an emergency contact list for the participant. Do they know who to call if there's an emergency? Do they have a cell phone? What's their cell phone number? What's your cell phone number? And that's all available to them. And the community resources for permanent supportive housing. What are those community connections that they need to be able to be successful? I often say, what makes a house a home? Because it's not just a place that you live. What is your home? What can you do to make that feel like they have ownership over it? As you know, many of the people that you serve haven't had housing in sometimes 5, 10, 15 years. And they may not even know how to, do the dishes or how to take out their garbage on a regular basis, how to clean. Those independent living skills and connecting them with those independent living skills of person. If you guys have one at your clinic, or I'm sorry, at your organization, and connecting them with those, or you just teaching them, if you're taking the time, teaching them how to turn on their oven. I live in Arizona. It gets to 115 degrees in the summer. I had a lady who didn't know how to turn her air conditioning. So she was sitting there in her house in 115 degrees and she could have died. So it's those simple things that we take for granted, that, those skills that we need to be teaching people when they move in, so that they're able to make a house a home and they're able to be successful in that home. What are those substance use resources? What are the clinics? What is the school? What are the rent and utility assistance? What is the transportation like? How long is it going to take them to get to their clinic if they need to go to the AA meeting if they need to go to? What are those meaningful daily activities? Because one of the number one things of why people are not successful in housing is boredom. They will bring their friends from the streets into their house, and that could cause them to get evicted because they have unauthorized occupants living in their unit. So creating those meaningful daily activities for someone who's in the program that you're serving, so that they're able to have other ways to interact with people. Again, food pantry, food is so critical, important when somebody moves into housing. And do they even know how to cook the food? Do they have a can opener to open their food? I mean, all of these things that sometimes we all take for granted are important pieces to make sure somebody is successful while they're housed in your program. Again, creating that resource list of resources that are available. And that resource list, you can make it, you can tailor it to each area that you have people living in, and you can give out that resource list, update it as you need to, and making sure that they have some way to get in contact in case something happens.
We have a question.
Yes.
We provide voluntary support services. How should we attempt to engage with people in a voluntary program structure?
Again, that I always say, the services are voluntary and flexible for the clients or the tenants, but not for us. So it's just about engaging. When you do an assessment with somebody, find out what their likes are. What do they like to do? What makes them tick? It's just like if you're, I want to say, on a date, or if you can even create a questionnaire. When's your birthday? What's your favorite color? What do you like to do? Creating a questionnaire that you can engage with them with, that allows you to understand them more, and it'll allow you to have an opening for some services. Again, it's about their choice of what they want, but maybe creating a simple questionnaire that you get to know the people that you're serving, or just simply having those discussions with them and asking them what are their goals, what do they want to do when they get the excitement of getting into housing. What do you want to do now? What is your next step? This is amazing, you achieved this. What do you want to do next? Do you want to go to cooking school? Do you want to go to whatever they want to do? Just making sure that you're engaging with them and knowing what their likes and dislikes are, and that allows you at least a foot in the door if something, to let them know that you're there. And just creating that menu of options of services that you have available. Bring it to their house, stick it on their refrigerator, and say, if you ever need to do X, Y, and Z, here's a list of all the stuff we have available. And just talk it up. You have to be a salesperson, really. Hopefully that's helpful. And this is the end of our presentation. I just wanted to leave this quote by Matthew Desmond from the book Evicted: Poverty and Profit in the American City. Decent, affordable housing should be a basic right for everybody in this country. The reason is simple. Without a stable shelter, everything else falls apart. And that's what permanent supportive housing is about. It's about having a safe place for people to live, to be able to lock their doors, and to be able to have those services connect to them and come to them, and meeting them where they're at. Ooh, I know I talk fast.
That's wonderful.
So is there any,
Nikki.
oh, yeah, is there any questions?
Yes, we do have a question. Can we please receive this training in an email? And I believe Rand did state once it's put on YouTube, it'll be available.
Okay. Rayanne,
Thank you all. Thank you all so much. Great audience. We thank you guys so much.
Is there any, Rayanne, I don't know if you want to come off mute. Is there anything else you want to say? Or wait.
Yeah, really just to reiterate kind of throughout the chat, thank you everybody for participating in the chat and having conversations, and really that's what the space is intended for. So I appreciate kind of the engagement and your questions through that. The kind of cheesy other thing to add is just remember that your trainers are available to you. Like I met with an agency I think 6 times or 5 times over the last week or so. We went over all things landlord tenant law, mutual terms, notices. What are all those things mean? Kind of deep dive into services. We can help support you through the different ways to engage, maybe the seemingly hard to engage, right? All those types of things. We want to help you be successful and what that looks like. So please reach out. We'll get you connected. And then remember to look at Pathways to Housing, one of the links that I put in there. We have some fabulous modules that were put together by Advocates for Human Potential about how to be a supportive housing specialist, how to do landlord engagement. There's trainings and things that are available to you. So just happy that you're here. If you don't receive these announcements regularly, email me. We'll get you added to the listserv so that you can get these. On the housing end, we offer anywhere from like 5 to 10 webinars a month, trainings, things like that to help support you. So yeah, that was long-winded, but yes, we're here.
No.
And thanks for participating.
That was wonderful, Rayanne. We do have some questions. I
Riley.
appreciate,
Yeah.
Riley. I appreciated Lisa's question earlier. I personally have difficulty balancing being a support staff in FCS housing and having assigned tasks that require operating within a landlord property management role. I can see firsthand how that can be confusing for participants and get in the way of developing trust and rapport, especially, I have to move down. Especially if you are seen as someone who has authority over their housing. Do you have any advice?
So advice as far as the separation. I think you can point back to the SAMHSA fidelity model of the separation of housing and services. You know, it's good to demonstrate evidence-based practices. And I'm trying to think, Rand, do you have more insight as far as, because I don't know this organization or how they're functioning, but I agree it's confusing for the tenant because you as a service provider should not be collecting rent and things like that.
Yeah, I think same as you, Nikki, it depends on kind of the specifics of the organization, but it would not be abnormal for us to sit down and talk through what that looks like and maybe help you build out some policies and procedures around that. Your trainer can do that. Like we can actually write those for you and help present it. And in some cases, it might take some conversations with leadership about why that's important, what that looks like. Kind of how do you still maintain billings and all of those pieces, but we can definitely dive into that with you. Really, it's, you know, when you're kind of stuck in that situation, which very much I have been for the first like 6 years of my housing career, that was, I did the support services and did all of the notices and went to court against you, right? Like that's a really hard relationship to have with participants. So there's some things that we can do kind of to support as they begin the journey with you in terms of what kind of documents or things do we have available for them to help them understand when and how, you know, what role you might be, different ways that you might introduce yourself during every single time you meet with them. This is the hat I have on. But typically we can kind of help you try to navigate what that might look like. And sometimes it's exploring with leadership what some additional funding might be that they might not know about to kind of help separate that so that you can have just that support role. But we'd be happy to do that with you.
Yeah, and also, you know, Rayanne is a fidelity reviewer. So, you know, depending on what organization it is, you know, she may visit that organization. And I think once if the organization goes through a fidelity review and they could recognize that there's some areas that need some separation, and there's also instruction on how to do that, setting, again, to Rand's point, setting up those policies and procedures. But sometimes that stick is the funding, unfortunately. I should say the carrot, right? Not the stick.
Wonderful. Any more questions? You can come off mute if you don't want to put it in the chat. Yeah, you guys have been fantastic. We appreciate you all so much. We love the great comments that you guys all had in reference to the training. So we appreciate that as well.
And I just want to thank you all for what you do every single day for the people you serve. It is so extremely valuable and important, and you may never hear a thank you from them. You may never see the seed that you plant, but you are planting a seed for people and creating a new life for them. And you're creating a ripple effect that'll last throughout their lifetime. And you may not ever see that thank you, but you guys are doing amazing work. And I want to say, I know how difficult and hard it is. And the fact that you all are still plugging along is just a testament to what beautiful people you are. So thank you for all that you're doing for the people that you're serving who may not have
That
a
is for
voice.
sure. I concur. I agree with you totally. You guys, this is a special job, a special position, and it takes a special person to do this type of work. Being a housing specialist for so many years, I really relate and understand the importance of your role. And you guys definitely, you're the heroes for our clients, for our participants, for sure. Mhm. Okay,
Yeah.
it doesn't appear to be any more questions. We thank you all once again. Thank you, Rayanne, and
Thank you,
guys
Rayanne, for
have a
having
wonderful
us.
day.
All right, take care, everybody. Thank you.
Take care.
Bye-bye.